Hello.
My name's Nadine. I'm going to be your personal support worker this morning. Today I'm going to be taking your height, your weight, and your vital signs. But before we begin, can you please confirm your name and date of birth for me?
Keith Lajoie, September 21st, 1979.
Great. I've checked that against your care plan, which also has your picture, and it is correct. I'm just going to step out to gather my supplies, as well as get someone to help me measure your height. Before I go, I just want to confirm that you haven't had anything to eat or drink, chewed gum, or smoked within the last 20 minutes.
No, I haven't. I just woke up.
Okay then, I'll be right back. Okay, Mr. Lajoie, I've brought in the supplies that we're going to need. I'm just going to clean my hands, and I brought along someone to help me. Her name is Emily. She's just going to help me measure you. So what we're going to do is just take your pillow out, make sure it's not there. Emily's going to hold the measuring tape at your heel. I'm going to measure you straight up with the ruler, flat against your head. Okay, now that we've done measuring you, I'm just going to get rid of this, and Emily is free to go on. Okay, and I'm just going to record here your name, the date, the height that I measured, that you were lying in your bed, and that I used a measuring tool. And then I'm just going to clean my hands, and we'll move on to the next part. All right, Mr. Lajoie, now if I can just ask you to take a seat at the side of the bed here. We're going to complete the rest of your vital signs. First, what I'm going to get you to do is we're going to check your temperature. So I clean my hands and turn the thermometer on. I'm going to pull your ear up and back slightly. We'll stick it in. Press till we hear beep. And that is our temperature. Now that I've checked your temperature, I'm just going to document on my sheet the type of thermometer used, that your temperature is 36.7 degrees, and that I used your right ear. I'm also going to dispose of the garbage. Now I'm going to check your radial pulse. So what I'm going to do is I'm going to take my fingers and I'm going to place them just below on your wrist, just below your thumb. I'll be able to feel pulsating beneath. What I'm going to get you to do now is just put your hand across your chest, and I'm going to time it for 30 seconds. For the purpose of this video, I'm actually going to be checking the respirations. It is best if the patient does not know that we are counting the respirations. One respiration is one inhale and one exhale of the chest, which can be felt while you're pretending to check their pulse. So we're going to do this for 30 seconds. Now that I've checked his respiratory rate for 30 seconds, the number I got was 6. We would multiply that by 2 in order to get our breaths per minute, which would be 12. We would then continue for another 30 seconds, checking the pulse. So every time we feel the pulsate underneath our fingers is 1 beat. We would count that for 30 seconds. Now that I've counted the beats for 30 seconds, I got 34 beats. If I multiply that by 2, that gives me 68 beats a minute. Now what I'm going to do is I'm just going to place this onto your finger. You can stick a finger in there. Thank you. I'm just going to check your oxygen saturation with this machine. %. Just going to take that off. Now I'm just going to ask you to move in the chair over here so we can check your blood pressure. I'm going to ask you to sit with your feet flat on the floor and hold out your non-dominant hand. With your because your non-dominant hand is the best choice for taking a blood pressure unless it's been injured or there is an intravenous cannula inserted into it. It's important that we're going to position your arm at heart level with your palm facing up. And I'm going to locate your brachial artery. And what I'm going to do is I'm going to place this cuff on your arm. And line the arrow up about 1 inch from the elbow, lined up with the brachial artery. It's important to make sure that the cuff is snug and evenly fit all the way around. Next, I will push the button, and you're going to feel it getting a little bit tight on your arm, but it shouldn't hurt. machine has recorded your blood pressure, I'm just going to loosen this. And if you'd like, I can help massage your arm a little bit. If not, I will then put everything back and I will clean my hands. And I'm going to record again the blood pressure reading, how the patient was positioned, as well as which arm I used and the location on the arm. Now I'm going to ask you, Mr. Lajoie, if you could please go to the washroom and void before we get you to stand on the scale. Mr. Lajoie, I've already cleaned my hands. Now that you're done in the bathroom, I'm just going to ask if you can take off your robe and your slippers and then step onto my scale. For the purpose of the video, Mr. Lajoie is wearing shorts. Typically our patients will either be in their pajamas or nothing on prior to a bath. Now we're just going to zoom in and see how much Mr. Lajoie weighs. Now that we're complete the weight, I would then help my patient back to their bed, make sure that they're safe, and provide them with their call bell. I would then complete hand hygiene and take the list of vitals that I obtained and record them as per my agency policy. And then I would compare my findings to the previous values and ensure that anything that was abnormal is reported to my nurse supervisor.